Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Adam Ahmad Adam. You are welcome to this lecture in Parasitology. It is about myiasis. Myiasis is infestation of the body tissues or cavities by maggots. Maggots are larvae of Diptera, two-winged true flies. The picture on the right hand side is a two-winged true fly, and the picture on the left hand side is of a maggot. Maggots are common in tropics and subtropics. They are associated with poor sanitation and poor hygiene. Infection versus infestation. Is there any difference between infection and infestation? Infection is invasion of the body by unicellular pathogens, bacteria, protozoa, viruses, and fungi. Infestation is invasion of the body by multicellular pathogens, worms, and arthropods. Types of myiasis according to maggot specificity. 1. Obligatory or specific maggots. Here the maggots infest living healthy tissues. And you see obligatory maggots and their corresponding adult flies, Dermatobia hominis, Cordelobia, Anthropophaga, and Ostris ovis. Myiasis caused by obligatory maggots. Cutaneous myiasis caused by Dermatobia hominis or Cordelobia anthropophaga. The red arrows are pointing to the sites of myiasis, and the green arrow is pointing to a maggot. Ophthalmomyiasis caused by Ostris ovis. The black arrow is pointing to the site of myiasis. 2. Facultative or semi-specific maggots. The maggots here infest wounds and damaged tissues and further invade adjacent healthy tissues. This can be caused by maggots of Musca domestica, the housefly. Wound myiasis. Myiasis caused by facultative semi-specific maggots. The flies lay eggs in decomposing flesh or suppurating wounds, then the eggs become larvae. Here the arrows are pointing to maggots in wounds. 3. Accidental or non-specific maggots. The eggs are inoculated into a hollow organ via its orifice, then they develop into maggots. The inoculation can be by ingestion, sniffing, or manual inoculation, leading to myiasis of body cavities. Can be digestive cavities, nasal cavities, genital cavities, oral cavities, and eye cavities. You see the rat tail maggot can cause accidental maggot that leads to myiasis. It is produced by the fly Eristalis tenax. The diagnosis: clinical familiarity with the disease, then entomological identification of the maggots. Treatment: the maggots usually go out of the body when they become pupae, but the wounds may become infected in addition to the terrifying effect of the lesion. Extraction of the maggots by one suffocation. The maggots breathe the atmospheric air. You can add a drop of oil to the wound opening to suffocate the maggot. Then it wriggles out. It comes out. 2. Manual removal. You have to be careful because the maggots are fragile. 3. Use of topical ivermectin. 4. Surgical debridement. You have to be careful because the maggots are fragile. Then administration of antibiotics to guard against secondary infection, and give anti-tetanus if the patient is not immunized. Maggots are of benefit to human. Maggot debridement therapy. Maggots are used to clean wounds that are difficult by surgical cleaning, such as diabetic foot ulcers. They clean these wounds by feeding on their debris. They reduce bacterial activity and dissolve the dead tissues by their secretion. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.